Hi, my name's Ross Hauser. I'm Medical Director at Caring Medical here in Fort Myers, Florida. We also have an office in Oak Park, Illinois, which is around Chicagoland. I'm making this video for Meredith Grigsby, who came to me as a patient. Most of you know Meredith has had a lot of pain over the course of many years. What you may not be aware of is that she has Ehlers-Danlos syndrome, which is a genetic disorder where the ligaments of her body are stretched out. And what that causes is joint instability. And I'd like to just demonstrate it. The ligaments of the body, they hold the bones together. They're akin to the screws on a door hinge that hold the door in place. So we all know when the screws get loose that the cabinet doors start hitting. Well, imagine if all the ligaments, and this is a ligament, this is the hip joint, this is the pelvis, this is the hip joint. So imagine if all the ligaments all over your whole body were loose. Then when Meredith walks or does anything, her bones are going to move excessively. And even now I can feel that this bone right here is hitting that bone. And when that occurs too much, you can actually get the cartilage to break down. And you can imagine when the bones are moving too much, how much muscle spasms you're going to get to try to stop that extra motion. Now, Ehlers-Danlos syndrome that Meredith has, it can cause pain all over the body. And one of the main areas that's affecting Meredith is her neck. And we all are probably familiar with the spinal cord. This is the skull, and this is a person's neck. So you can imagine if, like in Meredith's case, if you have excessive motion, as she does in her neck, that can start hitting nerves. These are the nerves right here in the neck. This artery right here is called the vertebral artery, and it supplies 1/3 of the blood supply to the brain. So imagine if periodically, like in Meredith, it's getting cut off. So that can give you symptoms such as dizziness, vertigo, ringing in the ears, besides just migraine headaches and severe neck pain, along with pain in the face and pain down the arms. Her condition is very serious because it's affecting all of the joints of the body. Fortunately for her, there's a treatment, and that treatment's called prolotherapy. And I'll use this as actually a prolotherapy syringe with the solution in there. And what prolotherapy does is prolotherapy injections around and into the ligaments can tighten the ligaments. The most disabling feature of Ehlers-Danlos syndrome is the looseness of the joints. So much like the cabinet doors that are hitting, because the one door has moved over and is now hitting the other door, the cause of that is the hinge being loose. So when a hinge is loose, you know the screws are loose, and you need to tighten the screws with a Phillips screwdriver. The treatment when the ligaments are loose or stretched out is that you need to do prolotherapy injections into the injured ligaments or the stretched out ligaments. Because Meredith's ligaments all over her body are stretched out, she's not a surgical candidate. She needs to get prolotherapy injections into almost all the joints of her body. Because the condition is so systemic, it's a very expensive endeavor, though it's much less expensive than surgery. So that's the purpose of why she's trying to raise funds for her medical treatment. If you have any questions about prolotherapy, now I should say that prolotherapy, it isn't just one treatment per, like say, the wrist joint. The average number of visits is about 4 to 6 visits per joint to stabilize the joint. And once the joint's stabilized, Meredith should do very well. It's my professional opinion that if Meredith doesn't get prolotherapy, her condition will absolutely progress, and she's going to end up to be very disabled. With prolotherapy and the proper prolotherapy in the various areas of her body, the prognosis is very good. So I'm very excited for her. She started treatment, and obviously we would all like her to be able to continue treatment if she gets the funding. If you have any questions for me, please feel free to email me directly at drhauser, Hauser, at caringmedical.com. And if you want to learn more about prolotherapy or even to see the procedure, I would encourage you to go to YouTube and type in my name, Ross Hauser, Hauser, prolotherapy, or type in Caring Medical. For those who really are interested, go to www.caringmedical.com or www.prolotherapy.org, and those are great sites that talk all about prolotherapy. Thank you. I know that you're going to help Meredith, and we look forward to having her make a great recovery.